safe. My name's Crane Durham. Crane Durham's Nothing But Truth, and we've got a very limited amount of time with an extraordinary guest, our friend Dr. Paul Howard. He's a Manhattan Institute Senior Fellow and Director of the Manhattan Institute's Center for Medical Progress. He's the Managing Editor of Medical Progress Today, a blog providing a forum for economists, scientists, and policy experts to explore scientific, regulatory, and market frameworks that best support 21st century medical innovation. Welcome. How are you, Paul?
I'm doing great. Thanks for having me on, as always.
Yes, absolutely. Now, I want to play for you an excerpt from the press conference with the French president, and this is where President Obama was asked about what he did last night, which was, in essence, they changed the law. And he says, don't worry, it's not a big change. It's actually going to make things better. Roll it.
The overwhelming majority of firms in this country already provide health insurance to their employees and are doing the right thing. The small percentage that do not, many of them are very small and are already exempted by law. So you have just this small category of folks who don't provide health insurance, weren't exempted by law. They are supposed to make sure that they meet their responsibilities so that their employees aren't going to the emergency room, jacking up everybody else's costs, and the employers end up not having any responsibility for that. What we did yesterday was simply to make an adjustment in terms of their compliance, because for many of these companies, just the process of complying, they're mid-size, between 50 and 100 folks, it may take them some time even if they're operating in good faith. And we want to make sure that the purpose of the law is not to punish them, it's simply to make sure that they are either providing health insurance to their employees or that they're helping to bear the costs of their employees getting health insurance. So this was a example of administratively us making sure that we're smoothing this transition, giving people the opportunities to get right with the law, but recognizing that there are going to be circumstances in which people are trying to do the right thing and it may take a little bit of time.
All right. Paul Howard, Dr. Paul Howard, Manhattan Institute. Let me ask you, when a number of things jumped out at me, and from emergency room visits, the discussion on that's a couple excerpts from a longer answer, and you have to do that with any president, but specifically President Obama. The statements on jacked up rates or the idea of them doing things in good faith. Tell me something. The president changed a law yesterday. Is it a big deal, and why exactly did he do it in plain speak that we can understand, please?
Right. I think in plain speak, the reason they did it is because the midterm elections are looming not too distant in the future, and there's been a lot of pressure from the business community to delay this. I think there's been signs that employers were either cutting back on hours for workers who would be affected by this mandate, particularly low-income or moderate-income workers, small businesses, businesses like restaurants and other service industry businesses. And this was going to hit the administration hard in the midterms, and Democrats were also complaining about this. And they made this, I think, for practical political reasons, which is trying to avoid, negative headlines and more complaints from businesses right before a major election. Did he have the power to do this? Look, the president has already several times unilaterally basically rewritten the law, the black letter of the law. I think it's debatable, it's very debatable whether or not he has the power to do this. On the other hand, you could say, like, if there's a Republican president in 2017, this is basically rewriting the rule book, and that a Republican president could make lots of unilateral changes to the law without having to go through Congress. This is a real double-edged sword the president's wielding right now.
How does this impact the overall funding of the bill? And when you just delay something, you're still going to have to do it, so won't those job losses just be put off? Or will that change the business calculus overall by delaying it?
Well, I think it probably does change the business calculus. You've already gotten 2 delays now. past the midterms. And I think the question then becomes. And by the way, I think the employer mandate is just a bad idea. You should not be penalizing companies for not offering coverage or for not offering coverage to certain categories of workers. It's just a bad idea. Just get rid of it. If I was the employer community, I think, maybe the thing's still hanging out there, but, better than even money that this thing goes away at some point. Congress doesn't seem to have any appetite for doing it and would like to get rid of it. So I wouldn't be surprised. It's just going to make it slightly more expensive for the law, possibly. But on the other hand, it's already extraordinarily expensive, and this is probably a change at the margin. Already expensive bills going to stay very expensive. If you're the employer community, I think you'd get another bite at the apple sometime in the future. Maybe this whole thing will just go away as far as the mandate is concerned. And where the big problem would be for the president is now on the individual mandate. Why are you giving breaks to businesses and corporations, but not to individuals who still have to comply to the law? That is the big looming headache, I think, for them.
Okay, and wow, so it really does send the signal that this is collapsing, and each time he does this, the snowball gets a little bigger for the potential for that to roll all the way down and completely collapse, go down the hill. Let me ask you this: the 2.5 million less jobs, does that mean that this will kill 2.5 million jobs? A lot of people have taken issue with the interpretation of the CBO report, and I want to cut beyond the semantics and tell me the outcome. How does this end, the result? What does it mean when the CBO says there's going to be 2.5 million or less people working?
Right. So the CBO said that effectively, because employees at the lower income end and some not so low income end are facing generous subsidies under the law, but they're also facing implicit tax rates, very high tax rates. So if you earn $1 more in income, you're losing more than $1 in subsidies. So that encourages people either to work fewer hours, retire from working entirely if they can get free health insurance now without having to work. Maybe retire at 63 or 62 instead of 65. And this effectively cuts back on the number of people who are seeking employment, and the CBO said by 2024 this is the equivalent of 2.5 million fewer full-time jobs. Now the Democrats and supporters of the law will say, look, if people are quote unquote choosing not to work, that's not a bad thing. They've got more leisure time, they've got health insurance. That's a good thing. I think the CBO has also made clear this also means there'll be fewer jobs over the long run. The economy will grow more slowly, and that's not a good thing. So I think, from a perspective of, should we be using health benefits in effect to disincentivize particularly low-income people from working more and earning more, I think that's a very bad idea.
Paul, the president's view of this bill and the way it goes forward and the politics behind it, we are going to be left with something in dealing with the interim. When I hear the president speak to the people that have lost their health insurance and have the opportunity to buy a better plan, but that's going to be higher, the whole response to this, as you are looking at it and saying, okay, well, this provides an environment that we will have reform, that when Obamacare leaves us, there will be things put in. Republicans obviously put forth some ideas about a couple weeks ago specifically. Your thoughts on, okay, we get rid of Obamacare, the mandate individual, the mandate business, it collapses financially, it can't sustain itself, it's done. What do you put in there, Paul?
Right. I think you raise a very, very good point. So Republicans have put forth a number of different proposals, most recently, as you just alluded to, from Senators Burr, Coburn, and Hatch on the Senate side. I don't think there's any going back to the pre-Obamacare world. Too expensive, too many problems. We recognize that for some small segment of the population with pre-existing conditions, they couldn't afford coverage or couldn't get coverage. The Republican plans are addressing all of those things and also looking at the disparity between employer-based insurance and seeking insurance on the individual market. I think all of those things are going to get addressed in any kind of Republican reform, replace plan, whatever we will want to call it. I think that's going to be on the board. And you said when this thing collapses, I think what we're looking at here, so there's enough money flowing through risk corridors and other reinsurance mechanisms, both through employers and from taxpayers into the exchanges to keep them going for 3 years. So let's say till 2017. When those things sunset, I think then the exchanges become a lot more financially problematic. and it's a question whether or not the insurers are going to stick out that market after the taxpayer protections go away. And then I think you might have a real appetite, especially if there's a Republican president in the White House, but even then, for fiscal reasons, to really revisit the law in a wholesale way and either get under the hood and make very substantial reforms or replace it entirely if you've got the votes.
What is the Medicaid situation? Because it seems to me that the administration's gone forth with some numbers on Medicaid and the increase of the amount of people, but we know this program already has funding problems, and it's for a specific group. And it seems that has been expanded, as well as states who have signed on and made that Faustian bargain inevitably are going to get kicked by it financially. Your thoughts on the Medicaid expansion, and where do we go from here in relation to that?
Right, I think ultimately, it's a system that is, you put it, is bankrupting the states. Whether you're in New York, a blue state, or Texas, a red state, it's bankrupting you. So, you can expand. The federal government can say, look, we're going to pick up 90% of the cost for the first 3 years, 100%, I'm sorry, 100% for the first 3 years and 90% after that. But 10% of bankrupt is still more bankrupt. So that obviously is not a sustainable situation. CBO projects that by 2020, between the states and federal government, we're going to be spending close to $1 trillion annually on Medicaid between the states and the federal government. That's just not sustainable. No real reforms of the program are in the law. And again, Republicans have put forward some good ideas, around block granting the program or some variation of that, of giving states more freedom to experiment with different kinds of Medicaid coverage, but also block granting and say, here's the money you're going to get. This will increase at a certain rate, but you have to spend it wisely. And I think that would also end a lot of the financial shell games that the states play with the federal government to try and get more money, not just for healthcare programs, but for, in general for their state budgets. So that's got to be on the table. And then the question is, when is that going to happen? I think, as CPO continues to project, look, our healthcare expenditures are still rising faster than we can grapple with them. Fundamental reforms, still have to be enacted. So when we get, perhaps a change in policy and leadership, when we really recognize this is a problem we have to grapple with, I think it's not too distant on the horizon.
Do you believe the books were cooked when it came to the CBO, or are they just dealing with the equation that's put in, the numbers they have to, the equation that they're given and they have to follow?
Right. I mean, CBO really has to, score legislation before them. So they have to score what's called current law, not current policy. So for something on Medicare's sustainable growth rate, which is supposed to have a cut around 20% annually to Medicare physician payment rates, it never happens because Congress thinks, we're going to have this huge physician cut, physicians drop out of Medicare, seniors kill us. That is never going to happen. CBO can't turn back to Congress and say, yeah, you just, you passed me a bill that scores and says savings, but I know that you guys are never going to do that.
Right. They've got to go by the assumptions. They've got to go by the assumptions they're given.
Exactly. They're constrained.
Gotcha.
But what they have done is done a lot of alternative scenarios recently,
yes,
which I praise them for, showing
gotcha,
what really the trajectory is. They've been I think pessimistic, and that is something we should encourage.
Amen. Let's encourage those. Dr. Paul Howard, thank you, my friend. Manhattan Institute, wonderful. Out of time. Great to be with you. Crane Durham's Nothing But Truth, probably on AFR Talk.